with Suresh Kochari. The World Health Organization and its leading partners have agreed to roll out 120 million rapid diagnostic tests for coronavirus to help lower and middle income countries make up ground in a testing gap with richer countries, even if yet it's not fully funded yet. At $5 apiece, the antigen-based rapid diagnostic tests for which WHO issued an emergency use listing last week, the program initially requires $600 million and is to get started as early as next month to provide better access to areas where it's harder to reach with PCR tests that are often used in many wealthier nations, the WHO announced on Monday. The rapid tests look for antigens or proteins found in the surface of the virus. They are generally considered less accurate, though much faster than the higher grade genetic test known as PCR test. Those tests require processing with specialty lab equipment and chemicals. Typically, that turnaround takes several days to deliver, and to the patients, it's a horrible waiting time. WHO Director General Tedros Adhanom hailed the program as good news in the fight against COVID-19. These tests provide reliable results in approximately 15 to 30 minutes rather than the hours or days at a lower price with less sophisticated equipment. This will enable the expansion of testing, particularly in hard to reach areas which do not have lab facilities or enough trained health workers to carry out the PCR test. We have an agreement, the WHO said, to have a seed funding and now need the full amount of funds to buy these tests, the WHO Director General said without specifying. Dr. Katerina Baume, Chief Executive of the non-profit called Foundation for Innovative New Diagnostics, said the rollout will be in 20 countries in Africa and would rely on support of groups including Clinton Health Access Initiative. She said that diagnostic tests will be provided by SD Biosensor and Abbott. Peter Sands, Executive Director of Global Fund, a partnership that works to end epidemics, said it would make an initial $50 million available from its COVID response mechanism. He said that the deployment of the quality antigen rapid diagnostic test will be a significant step to help contain and combat the coronavirus. They are not a silver bullet, but hugely valuable as a complement to PCR tests, since although they are less accurate, they are much faster, cheaper and don't require a lab, he said. Many rich countries have also faced problems in rolling out accurate tests, and testing itself is no panacea. Countries like France or United States have all faced backlogs and hiccups at times, and rapid tests in Britain and Spain have turned out to be inaccurate. But rolling out testing in poorer countries aims to help healthcare workers get a better grip on the virus it's circulating, in the hopes for following up with containment and other measures to stop it. Sands said the high-income countries currently are carrying out 292 tests per day per 1 lakh people, while lowest income countries were conducting 14 for 1 lakh people. He said that the 120 million tests represent a massive increase in testing, but were still a fraction of what is needed in these countries. Thank you.